Hi, I'm Stephen Hand. I'm running for mayor. Today, one of the councillors I really respect wrote me a message, and it was quite long, and asking me about my views and stuff like that. And I'm going to go into one of them, and it's about hospitals. She said, hospitals are a state issue, so I kind of want to know why you're getting at this. Well, hospitals, down south, we're 170,000 people, and we have we've got Noarlunga, which has an ED, but there's huge waiting times. And whenever I look at the statistics for Noarlunga, they're much longer waiting times than Adelaide Hospital. Like, it's not even close. And I've never seen it where Noarlunga queues are less than Adelaide Hospital. Then I'm like, well, if you have let's say you have a baby, I'm going to say if you had a problem, but let's say you have a baby, you've got to go to Flinders. That's a long travel time, especially for the people down south. I think there should be local services. I was born in McLaren Vale Hospital. Don't do babies anymore. I think they should. And then let's say you need services. And let's say it's not offered at Noarlunga Hospital. That means you've got to go down to Flinders. And you know what car parking's like at Flinders. It's not good. It seems like we've been pouring heaps of money into Flinders. Now, there's no real cost savings with having a huge hospital either. There's no cost savings. That hospital's an expensive hospital to do basic stuff at. And how do I know? Because I used to do the cost of the hospitals. That's what I used to be responsible for. So sometimes the smaller hospitals are more efficient. Okay, so look, I want to have that debate about services down south. Maybe, and basically what people need down south. And, I want to get data. So I want to get data on what services people in Onkaparinga are needing. I want to get data on what services further south people are needing, country people are needing in this area, and then present that to the Department of Health and to our local members and say, look, this is our needs for our area. And this is where our people, Onkaparinga residents, are going for services. Is that acceptable? Right, so yes, it's a state issue and it doesn't affect council, it doesn't affect your rates, but it affects your ability to be serviced. And it appears to me that I don't see anything from any local members raising this as a concern and saying, look, we need better services for Noarlunga because we got no funding. We didn't get any extra funding for Noarlunga or McLaren Vale when the whole funding came out, a big list of what new funding was given out. Nothing was given down south. And yet, these seats down here are very safe Labor seats. No funding was given. Okay. So that's my thing on public hospital. I would like more services for public hospitals down south, and maybe a discussion about another hospital further south, like a Dinga area. Now we're going to talk about ED services. One of my friends got sick and had to go to hospital. Now, Noarlunga was full, Flinders was full, so they took them to Victor Harbour. 1 hour there, 1 hour back. You live in the Christie's Beach area, which, how much did it cost for the 1 hour ambulance there and back? It's like, we need to have these discussions about costs. And it's not about, everyone's like, give health more money. It's not about that. It's about efficient use of money and resources. It's not acceptable if we're 170,000 people and we don't have access to an emergency department. That's not acceptable. It's not acceptable in my eyes that we don't have accessibility for services. One of my friends has got a potential cancer. He's waiting 3 weeks for a scan for that. It's like, well, you go elsewhere. Well, actually, they're all full. Now, that's not acceptable. Then on my hospital services hat, when I've got that hat on, because I should probably have one because I've got no hair, private hospitals. We have 170,000 people, which I keep half the size of Canberra. Canberra has 3 private hospitals. 3, and they're good-sized private hospitals, like big private hospitals. 3 in Canberra. I'm going to say nothing down south. Now, I worked very closely with all the private hospitals in Australia, and I knew a lot of them in my roles, okay? In my role in the Department of Health for 10 years. So I worked with them all individually. And some of the private hospitals, some of them, well, I know some of the ones in Adelaide better than others, okay? So I dealt really closely with some of the ones in Adelaide. And they had amazing services. But they're pretty much full. So I'm like, well, could they expand? Could they do with another facility? What would it take to have another facility? And would down south in Onkaparinga be a place where they'd consider moving to? Maybe they would, maybe they wouldn't. But unless you have that discussion as a council, as residents saying, hey, we'd really like a big private hospital down south. Now, a lot of people are going to say, well, I can't afford private health insurance, I can't afford a private hospital. Okay, but it takes the pressure off the public hospital. So it makes it easier for you to get into the public hospital. And there's lots of people with private health insurance who'd go, a big private hospital would be awesome down south. And I'm like, it would be really awesome down south because people from Adelaide would come down south because it's easy to get to. Easier car parking, easier everything. I mean, try parking at some of the private hospitals in Adelaide. It's a nightmare. You know it's a nightmare. Down here we've got all the land, all the space. We've got a big population, a big growing population down south. So I want to have a conversation with hospitals, and one of the councillors said, well, you can't really do that unless you get permission from the councillors to do that. And I'm like, well, who's going to say that's a bad idea? Who's going to say it's a bad idea to talk to a hospital and say, hi, Sportsman. I'm going to pick Sportsman because they're literally one of the best hospitals in Australia as far as costs. They're an amazing hospital, very proactive. They always were when I dealt with them. Lovely, great management team there. And it's not taken away from the other hospitals, but I got it really well with Sportsman. And he said, look, what would it take for you to have a base down south? What would it take? I don't know what it would take. And then you have that conversation with hospitals, and then you bring it back to the council and say, look, we've had these conversations. This seems to be the general consensus of setting up a private hospital down south. Now, I dealt really closely with Epworth Hospital. Epworth Hospital is one of the largest private hospitals in Australia, in Melbourne. They've just set up a new hospital, and I've done this in the other video, down in Geelong. It's a big hospital. I would be really interested in talking to the CEO and saying, he's probably still remember, like he might have changed since I was there, but I'm hoping people still remember me because we had a really good working relationship for a number of years, and say, what did it take to get that hospital down there? Now, Epworth has expanded 3 times since I've been there. When I say I've been there, I haven't worked for them. I haven't done anything. I was in the Department of Health. Since I've been in the Department of Health, they've had 3 big expansions. What did it take? Was it a state government? Was it just their personalised funding? Have they just got the money? Like, how does this work? I want to have those conversations because, like, if our private hospitals are full, I'm pretty sure they are full, then we've got spare capacity. And it's like, we've got the ability to create more capacity. And down south, I don't want a private hospital up north. I want it down south. That's it. I want to stuff down south. And when my vision for things is like, when they currently build stuff, in the scheme of stuff for South Australia, when we build stuff, it seems to go out north or in the centre of Adelaide. I want down south to be the first thing people think of. Like, we have an amazing beach, we have amazing wine, we have tourism, we got land, we got stuff. It's awesome, and we're growing. I want it to be the first place you think of. Come to council and we will help you out. We will help you. We're going to give you chocolates. You come down here, we'll give you some chocolates. Right? Like, we're here to help. That's what I want. I want that mentality. If you want service, you want business, council, we're here to help. That's the story I want. If you're a sporting association, a sporting group, and you need something, you come and talk to us. That's what I want. And then the council, all the councillors can discuss it and go, is this a good idea for the area? That's what I want. So that's what I want for hospitals. And that's why hospitals is the first thing I raised. Because people are waiting. Like, if you need resuscitation in Noongar Hospital, at the moment, you've got to be seen within 2 minutes, and I'm pulling these numbers from the top of my head, and they'll get me in trouble, but you're meant to be seen in 2 minutes if you need resuscitation. Now, it's not like the statistics are not good. This is stuff that seems to be being ignored, and it's definitely not been raised by our local politicians. I've never seen it raised in 8 years, and I'm not like for Labor or Liberal. Like, it's like, we've got a problem, let's fix it. That's it. We've got a problem, let's fix it. And the problem is, down south, there is no hospital services, and we're a growing community, and it takes too long to get from where you live to the hospital. And when you go to the hospital, there's no car parking anyway because they're packed. So, and where they're building a new hospital is right alongside where they just built a new hospital. And that hospital is doing okay, and you're going to build another one alongside it. Like, that doesn't make any sense. Anyway, that's my prime thing. Let's raise this as awareness. Let's make this thing happen. Hospitals. Private, public, day surgeries. You create hospitals, you create jobs. And it's jobs from catering, it's jobs from cleaning, it's jobs from hospital records. There is receptionists, nurses, doctors, specialists, anaesthetists. It's thousands of jobs all down south. Change the world. Anyway, that's my thing on hospitals. That's why I raised it. And that was the plan to make it all happen. So, because one of the other candidates said, well, I don't know anything about hospitals, would you help me? There's the roadmap. That's how I intended to do it. Get the stats, show how much this is costing, show that it's viable. Let's talk public, let's talk private, let's talk day surgeries, go and talk to the people, see what it takes. And then put it back to the council and say, look, let's identify some spots where this is possible and practical, train lines. When I say train lines, maybe we should be close to train lines for it, close to public transport for people getting in and out of hospital, for workers and all that. I'm going to pick Lonsdale. Like, when Mitsubishi Motors was there in Lonsdale, we had a train line going to the front door of Mitsubishi Motors for all the workers to get in and out. It's empty now. We got the train station there. It's a big train station and no one used in it. And don't get me wrong, there's other train stations further south. And I think you probably want a hospital further south. But, like Aldinga kind of way. But, let's have a debate. Let's have discussions about this. Let's stop ignoring problems and putting them under the carpet and let's think about, my neighbour's tree that needs to be trimmed. Trimming your neighbour's tree ain't going to change anything. Anyway. I'm Stephen Hand. I'm running for mayor. I appreciate your vote. Thanks for watching.